Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. When we come back, we will be discussing TMJ and neuromuscular dentistry and how it can help correct jaw problems that can result in painful headaches, teeth grinding, jaw popping, and more that many of us experience with one of the Washington, D.C. area's leading cosmetic dentists, Dr. Michael Chung. Dr. Chung has created smile makeovers for many models and celebrities, is among only 1% of all dentists in the country who has advanced training in neuromuscular dentistry, is a member of the American Academy of Cosmetic Dentistry, a graduate of Johns Hopkins University, has received his doctorate of dental surgery from the University of Maryland, and also received extensive dental training at the world-renowned Las Vegas Institute for Advanced Dental Studies. Welcome back to A New Me. We are here with one of this area's top cosmetic dentists, Dr. Michael Chung. Welcome, Dr. Chung.
Thank you.
Can you please begin by telling us what TMJ neuromuscular dentistry is?
Yes, basically TMJ is loosely referred as any type of pain that they may have in the temporomandibular joint, any popping or clicking or any dysfunction they refer to as TMJ. Neuromuscular dentistry is basically teeth, jaw joint, and muscles. Basically, traditional dentistry only takes into consideration the teeth, how the teeth come together. In neuromuscular dentistry, that's important, but we also take into consideration the jaw joint as well as all the muscles that are attached to the jaw and how they function together. All three things have to be in harmony in order for everything to function in an optimum position. And that's what neuromuscular dentistry is all about.
And why is both neuromuscular dentistry and TMJ so important?
Well, neuromuscular dentistry is very important because in order for, like I said, for everything to function in balance and for the restorations to last a long time and for these cases to have a long-term success, neuromuscular dentistry has to be put in force. Otherwise, if you ignore any one of those three facets, cases will not last a very long time.
So basically the importance is in the area of harmony and balance, as you touched on, within the mouth.
Yes, because muscles are very strong, especially the masseter muscles. And if that is ignored, restorations will lose. Eventually the muscles will win over and the restorations will fail.
And what are the typical symptoms that people experience from TMJ?
Well, TMJ symptoms can vary, and there are many, many symptoms. It can be very simply known to people as popping and clicking or any pain in the area. That would be obvious symptoms. But sometimes if those are ignored, or there may be other subtle symptoms, such as the muscle headaches that can radiate to the temple area all the way to the back of the head. Sometimes that may radiate into the inner ears. You may have ringing sounds in your ear. You may feel stuffy in your ears. And some patients have clenching problems, grinding problems. Those are very common problems. And once they start clenching and grinding, they may have sensitive teeth. Teeth will become very sensitive to hot and cold. They may break teeth. You'll see some patients with a lot of wear and tear on especially the front parts of their teeth because of all the muscles fighting their teeth.
And who's a good candidate for neuromuscular dentistry?
Well, neuromuscular dentistry, like I said, any one of these patients that have these symptoms could be a candidate, as well as anyone that may have any major cosmetic dentistry work done, reconstructive dentistry, any large cases such as that, as well as any movements of teeth like orthodontics, because you're actually changing the patient's bite, and you want to optimize that bite position using neuromuscular dentistry.
So I take it there are no age restrictions, it's more problem-related?
No. Yes. Anybody who has muscles, joints, and teeth.
We're now going to see Dr. Chung perform a neuromuscular test.
Here's a patient going through a neuromuscular test right now. Usually we start out connecting many of the leads to most of the important facial muscles and structures. Well, these are some of the computer scans that we use to diagnose the condition of the patient's muscles and TMJ. And we do everything from actual sonography, reading the sounds in their joints, to actual EMG readings of all the muscles of the head and neck area. We do swallow tests to see how they're swallowing, because these are all the things that affects the occlusion. This is an electromagnetic scanning device, and there's a small, very powerful magnet that's attached to his lower jaw, and this scanner will actually be able to scan his jaw movements and do a bite analysis to within 1/100th of a millimeter, and the computer will be able to pick these out so that we can actually find out the ideal bite position and jaw position for this patient, dictated by the muscles and the joint. These bar graphs here, I take about 5 different scans, and what I do is measuring those muscles, we find out the most comfortable position for their muscles and the correct bite position. But once we go ahead and establish the perfect bite position to within 1/100th of a millimeter, I can actually capture that position in free space where the mandible sits with this polyvinyl material. It's kind of like rubber that sets up into a harder rubber. And what I do is I place that on the patient's teeth over top of his mandible, and we use the TENS machine and the computer to guide that jaw into that correct bite position where they're at the optimum resting length. Once the material has set up, we go ahead and ask the patient to make sure that position is very comfortable for them, and we check it on the computer to make sure that it has set up in the correct bite position.
We're now back with Dr. Chung. That was very interesting.
Yes.
We saw quite a bit of technology utilized in that test. I take it, obviously, that would result in greater precision and accuracy as far as diagnosis.
Yes, technology has come a long way. A few years ago, we would not have been able to do this type of dentistry. Now we can measure very, very precisely, and take into consideration all those measurements so that we can find a pinpoint position that's optimal health for these patients.
Now, let me ask you, Dr. Chung, is there any discomfort involved from this treatment?
None at all. As a matter of fact, all these procedures are non-invasive, and most of the patients actually find relief because we use what's called the TENS, as I described earlier, and it actually relaxes the muscles and cleans out all the toxins and lactic acid buildup, and it actually gives the patient relief.
And what kind of results can be expected from this?
Well, the results are very, very good in most cases. And as a matter of fact, at least 90% of the patients become very, very well enough that it tremendously increases the quality of their life.
We've heard from so many people who suffer from many of the symptoms that you've described here today, Dr. Chung. And they've gone to medical doctors to find out what the problem is, and they continue, it seems, in many cases, to suffer from these same symptoms of headaches and pain in the neck and jaw area, so on and so forth. What do you think is going on out there? A lot of misdiagnosis when it comes to the TMJ issues here?
No, I think you're exactly right. I think a lot of these cases go misdiagnosed because anytime you have pain in the head and neck area, the first thing that patient thinks of is their medical professional, their medical physician, and they seek for help there. But there's very little understanding in terms of the bite and these things with the actual physician. So I think what's happening is they're given pain medication or muscle relaxers to relieve the symptoms temporarily, but if this bite correction or their TMJ correction is not treated, it will recur. And I think a lot of these patients that I spoke to have been taking these medications for years, and they come and go, and they seek help from a neurologist, and they've had MRIs done, CAT scans done, and no one seems to be able to find the problem, so they kind of give up. And then somehow, at some point, it seems to come across in our interview. And that's when we sometimes question these and bring it out of them, and then we can actually diagnose it properly.
During your consultations with the
Yes.
patients. Now, we've only got a few seconds left, and I have to ask you if there's anything out there that our viewers should be cautious of or wary of when considering treatments.
Yes, like I said, with TMJ symptoms, it's very, very important to take all three dimensions of this for treatment, such as the muscles, the teeth, and the joint. So, and the fact that there's so little dentists out there that are even aware of neuromuscular dentistry is very, very important to check out the credentials. And absolutely, you need to get second opinion if they tell you to go get surgery done. So you need to make sure, that there are other options. At least get a second opinion from a neuromuscular dentist.
Well, that was certainly very informative. I want to thank you, Dr. Chung, for being a guest today on A New Me.
Thank you. It's been my pleasure.
Nice to have you with us again.